My name is Emily Trumbower, and this is my physical assessment midterm video. Walk in, pull the curtain, wash my hands. Hi Jenny, I'm Emily. I'm going to be your nurse today. Today we're going to do a quick head-to-toe assessment. Is that okay with you? It shouldn't take that long. Okay? Okay. So the first thing I'm going to do is start at your head. I'm going to put on these gloves and make sure nothing is going on your head that might include bumps, bruises, any kind of abnormalities that shouldn't be there, or bed bugs. Alright, if you'll look down. Right now I'm inspecting her hair and her scalp, and as you can see, everything looks normal as far as texture. There's no thinning of her hair, no bumps, no bruises, nothing that shouldn't be there. Everything in her head is symmetrical. And then I'm going to look at her skin and assess the color of her skin to make sure there's no abnormal redness, the temperature to make sure that she's not super, super hot or super, super cold. Her skin doesn't look dry or moist. Again, it doesn't look dry or moist, so the texture's okay. There's no abnormal wrinkles or anything that shouldn't be there at a young age. There's no swelling or edema in her face, so that's normal. There is no turgor issues that I can see because her skin is taut the way it should be. She doesn't have any bruises, no black eyes, so that's good. There's no nevy, I don't see any moles. Okay, can you raise both your eyebrows for me? Can you blink both of your eyes? Can you smile? Can you move your ears? No, I'm just kidding. Okay, so let's see. I'm going to palpate your temporal arteries. Do you feel any tenderness? Alright, then I'm going to palpate your lymph nodes. We got your pre-auricular, your post-auricular, your occipital, your tonsillar, submandibular, submental, anterior cervical, posterior cervical, anterior cervical, and your supraclavicular. Can you clench your jaw for me? Okay, let's see. Alright, clench your jaw. Alright, that's symmetrical. Alright, I'm going to lightly touch you. Can you feel this? Can you feel this? Can you feel this? Can you feel this? Okay. Alright, I'm going to look at your ear and make sure that they are in the right position, in the right shape. You don't have any kind of abnormalities like cauliflower ear. And this one also. Let's see, I'm going to look in your auditory canal and make sure there's no wax buildup and that your tympanic membrane is the right color. And yes, it is. There's no pus or anything built up behind it. That one too, still gray. And then the your cone of light in your right ear is at 5 o'clock. This is your left ear though, so it's at 7. And this is your right at 5. Now we're going to check your sinuses. Okay, so we're going to be percussive. You have your maxillary and your frontal sinuses. I'm going to palpate them, and they seem normal. So, alright, I'm going to whisper and you tell me if you can hear it. Yes. Yes. Yeah. Alright. I'm going to look at your eyes and make sure that everything is normal, your lashes, your eyebrows, that you don't have any abnormalities with your palpebral fissures. I'm going to look at your eyes and make sure that you have no lesions or redness in your eyes that's shouldn't be there. You don't have your sclera and everything is normal color, so that's good. You've got white. We're going to pretend that I am checking your pupillary responses. If you could follow my finger. Alright, follow my finger. This is for convergence. Make sure your eyes go to the same spot. Alright, then I'm going to take this imaginary pen light and I'm going to shine it this way. Go ahead and look forward for me. And we're going to see that your pupils dilate at the same rate regardless of which eye has light in it. I'm going to look inside of your eyes in this light, and there should be a red sunset color in both of them, which there is. Your nose. Your nose. Before we move on to your nose, we're going to do something else with your eyes. Tell me what you see in my fingers. Okay. Now we're going to move on to your nose. It's straight, it's midline. Have you ever had an issue with a deviated septum or broken nose? Alright. Everything is normal. No blockages, no bleeding. Alright. Have you ever had your eyes checked? Alright, well, we are going to look at this chart. Can you read that line for me?
Yes. Powder frame match out when next books.
Alright. Let's see, what else are we going to do? We're going to look in your mouth. Could you open your mouth for me? Alright, you got pink, moist mucous membranes. All of your teeth look healthy and intact. Your gums are still pink. There's no bleeding, no gingivitis. Your throat's not red, so we're good. Your salivary ducts. Open your mouth one more time. Looks good to me. Okay. Can you open your mouth? I'm going to test for TMJ. Okay. Do you feel tender? Oh my gosh. You definitely have TMJ. There's definitely a click there.
I was going to tell you that for the video.
Alright, open your mouth. And say, ah. Okay, everything moves the way it's supposed to. Your tongue is midline.
Whatever.
Alright, now we're going to look at your throat. Can you look up? This is where we're going to check the skin on your neck and make sure that, again, you don't have any abnormal coloration or temperature, texture, and all the other things that we expected your face for a few minutes ago. And no, you don't have any moles, abnormal issues, no skin that shouldn't look the way that it does. I'm going to walk behind you. Actually, first I'm going to check your trachea. And yes, it's midline. It's not deviated, which means that you don't have pneumothorax. Now, do you have a problem with me walking behind you to test your thyroid?
I do not.
Okay, and feeling for your thyroid gland. It does not feel enlarged or swollen. Bring it back around. Alright, we're going to test your carotid arteries to make sure that there's a pulse one at a time so you don't pass out. Alright, can you shrug your shoulders for me? Alright, now shrug them again, and I'll push down on them and keep them over if you can. Okay. I'm going to listen to your carotid arteries also to make sure that I don't hear anything I shouldn't, which is called bruit. No bruit there. No bruit there. And a bruit sounds like a squishing sound. I'm going to look at your back. Don't really lift your shirt up. And all right, can you breathe for me? All right, can you say 99?
99.
I'm gonna listen as you say that also and listen to your breath sounds.
Uh, 99. 99. 99. 99. 99. 99.
All right, now I'm gonna listen to your breath sounds. So take a deep breath in. All right, Louise. I'm also gonna check for something called your costovertebral angle. Okay. Tell me if you have any tenderness. Is that tender?
No.
And the skin on your back, again, meets all the normal criteria: color, temperature, turgor. No abnormal growths. Now I'm going to do it all to the front of your chest. Again, all normal coloring of a Reebok sweater. And we're going to listen to your breath sounds again, going from side to side. Now, using the L in my stethoscope, I'm going to listen to your breath sounds in addition. Now. All right. Go ahead and take a deep breath in for me. I'm going to make sure everything rises symmetrically, which it does. No flail chest or anything like that. Can you say 99?
99.
Now we're going to listen to you again. These are going to be your heart sounds. Right, this is your aortic point, your pulmonic, your Erb's point, your tympanic, and your mitral. And this is where, whenever we would be checking for your apical pulse, we would count for 1 full minute. All right, you can lay down now.
What?
Sure.
Okay. Oh, Lord.
I'm going to listen to your heart sounds again.
Oh, jeez.
And this time, I'm going to listen with the bell of my stethoscope, listen for any murmurs or anything of the sort. We're going to technically raise this 30 to 45 degrees, but I'm not going to make you do that. To assess for jugular vein distension, which, nope, you're good. And we also only heard S1 and S2, so there are no heart murmurs. We're going to check your bowel sounds and your belly, okay?
Okay.
While also checking for all of the skin conditions that we had talked about before. And we would listen technically for 5 full minutes if need be to do anything as far as diving, like figuring out your bowel sounds in each quadrant. Alright. Are you having any belly pain?
No.
Alright, what I'm going to do is I'm going to press to figure out where different things are, okay?
Okay.
Now I'm going to push and see if it palpates with me. I'm not feeling anything that I shouldn't. I'm gonna come around on the other side. Okay, you can sit back up. And I think we're done. It was nice to meet you, Jenny.
Nice to meet you too.